Have you ever noticed a strange tingling sensation in your feet while lying in bed at night? Perhaps you've felt a burning sensation that seems to come from nowhere. Maybe you've become a little less steady when walking, or you've discovered a cut or blister on your foot and couldn't remember how it got there. Most people assume these changes are simply part of getting older. But what if they're actually your body's early warning system trying to alert you to a condition that affects millions of adults around the world? What if your nerves are quietly sending distress signals before permanent damage occurs? Doctors say many people live with neuropathy for years before receiving a diagnosis. By the time they finally seek help, some of the nerve damage may already be difficult to reverse. That's why today's video could be one of the most important health discussions you'll hear this year. Before we begin, please take a moment to subscribe to the channel and turn on notifications. Here at Healthy Wisdom for Seniors, our mission is to help you stay healthy, active, independent, and informed after 50. And while you're watching, I'd like you to leave a comment below and tell us your age and where you're watching from. I personally read many of your comments, and your experience may help someone else recognize a symptom they've been ignoring. Now let's begin. Today we're discussing the 10 early warning signs of neuropathy that many people miss until the condition has already progressed. The final sign on today's list surprises many people because most don't realize it has anything to do with nerve damage. So make sure you stay until the end. Neuropathy, also known as peripheral neuropathy, occurs when nerves outside the brain and spinal cord become damaged. Think of these nerves as a vast communication network connecting every part of your body. They help you feel temperature, pain, pressure, and touch. They help control muscle movement. They even help regulate automatic functions such as digestion, circulation, sweating, and body temperature. When nerves become damaged, messages traveling through this network become distorted. Some signals are amplified. Others are weakened. Some never reach their destination at all. The result can be a wide variety of symptoms that often seem unrelated. Diabetes is one of the most common causes of neuropathy, but it's far from the only cause. Vitamin deficiencies, especially low vitamin B12, autoimmune diseases, infections, excessive alcohol use, certain medications, chemotherapy treatments, and even repetitive injuries can contribute to nerve damage. The challenge is that neuropathy often develops slowly. The symptoms may appear so gradually that people adapt to them without realizing what's happening. That's why recognizing these warning signs early is so important. Let's start with the first and most common sign. Number 1. Tingling and pins and needles sensations. One of the earliest warning signs of neuropathy is a tingling feeling often described as pins and needles. Most people first notice it in their feet. Others experience it in their hands or fingers. At first it may seem harmless. Perhaps it happens only occasionally. Maybe you notice it while watching television or lying in bed. Many people dismiss it because it feels similar to the temporary numbness that occurs when a foot falls asleep after sitting in one position too long. But neuropathy-related tingling is different. It often occurs without an obvious reason. The sensation may come and go repeatedly or remain for long periods. Some people describe it as tiny electric shocks. Others say it feels like buzzing beneath the skin. One patient told me it felt as though ants were constantly crawling across the bottoms of her feet. This occurs because damaged nerves begin sending abnormal signals to the brain. The brain receives messages that don't match what's actually happening in the body. If you experience tingling in both feet or both hands at the same time, pay close attention. This symmetrical pattern is one of the hallmark signs of neuropathy. I remember speaking with a retired school teacher who ignored tingling in her feet for nearly 2 years. She assumed it was simply poor circulation. By the time she sought medical attention, the symptoms had progressed to numbness and balance problems. The lesson is simple. Never ignore recurring tingling sensations, especially if they continue for weeks or months. Keep track of when they occur. Notice whether symptoms become worse at night. These details can help your healthcare provider identify the underlying cause. Number 2. Numbness and reduced sensation. The second warning sign is numbness. Unlike tingling, numbness involves a loss of sensation. You may notice that your feet don't feel the floor as clearly as they once did. Hot and cold temperatures may seem less noticeable. You may step on a small object and barely feel it. Healthy sensory nerves constantly send information to the brain. They tell us when something is hot, cold, sharp, rough, or painful. When these nerves become damaged, those messages weaken or disappear. Imagine trying to use a smartphone with a cracked screen. Some touches register, others don't. That's very similar to what happens when sensory nerves begin to fail. This symptom can be particularly dangerous because it increases the risk of unnoticed injuries. Small cuts, blisters, burns, and infections may develop without causing pain. For individuals with diabetes, this can become especially serious. One gentleman in his 70s visited a clinic because of an infection in his foot. He had no memory of injuring himself. Because he couldn't feel the injury, it had worsened for weeks before he noticed there was a problem. That's why daily foot inspections are so important if you experience numbness. Examine your feet carefully. Look for cuts, redness, swelling, or changes in skin color. Use a mirror if necessary to see difficult areas. Early detection can prevent complications that become much more difficult to treat later. Number 3. Burning pain. Have you ever felt as though your feet were on fire even though they felt cool to the touch? Burning pain is one of the most frustrating symptoms associated with neuropathy. Many people describe it as walking on hot coals. Others say it feels as if heat is radiating from deep inside the feet. This type of pain can range from mild irritation to severe discomfort that interferes with sleep and daily activities. Unlike pain caused by an injury, neuropathic burning pain often appears without a clear trigger. Damaged nerves become overly sensitive and send pain signals even when no actual threat exists. Think of it as a faulty alarm system that keeps sounding despite the absence of danger. What makes this symptom particularly challenging is that it often becomes worse at night. Many individuals report that symptoms intensify shortly after getting into bed. Sleep becomes disrupted. Fatigue increases. Quality of life suffers. If this sounds familiar, don't simply accept it as part of aging. Persistent burning sensations deserve medical attention because they may signal ongoing nerve damage that requires treatment. Number 4. Muscle weakness. Many people are surprised to learn that neuropathy doesn't only affect sensation. It can also affect muscle strength. At first, the changes may be subtle. You may struggle to open a jar that never gave you trouble before. Perhaps carrying groceries feels more difficult. Maybe climbing stairs suddenly requires more effort than it once did. Some individuals notice they begin dropping objects unexpectedly. Others find that tasks requiring fine finger movements, such as buttoning a shirt or picking up coins from a table, become increasingly challenging. This happens because motor nerves are responsible for carrying signals from the brain to the muscles. When these nerves become damaged, the communication pathway weakens. Imagine trying to stream a video using an unstable internet connection. Messages are delayed, distorted, or lost altogether. That's similar to what occurs between the brain and muscles during neuropathy. One patient I spoke with, a 68-year-old retired mechanic, assumed his weakening grip strength was simply part of getting older. Over time, he found it difficult to hold tools and perform basic household tasks. Testing later revealed significant nerve damage affecting the muscles in his hands. The important lesson is that persistent weakness should never be dismissed as normal aging. While aging can affect muscle mass, sudden or progressive weakness often signals an underlying issue that deserves attention. Early intervention may help preserve mobility and independence for years to come. Number 5. Balance problems and frequent stumbling. This warning sign is one of the most dangerous, particularly for adults over 60. Many people worry about neuropathy leading to foot ulcers or other complications. However, one of the greatest risks is actually falling. Healthy nerves constantly send information to the brain about the position of your body. This process, known as proprioception, allows you to walk smoothly without consciously thinking about every step. When nerves become damaged, those signals become unreliable. The brain no longer receives accurate information about where the feet and legs are positioned. The result can be unsteadiness, wobbling, or frequent tripping. Some people notice they feel less stable walking in dim lighting. Others find uneven sidewalks suddenly feel much more challenging. One of the earliest clues often appears in the shower. Several patients have reported feeling unstable whenever they close their eyes while washing their hair. Without visual information, they suddenly realize how much they have been relying on sight to maintain balance. A 73-year-old woman once told me she thought she was simply becoming clumsy. Then she experienced 2 falls within 6 months. Testing later confirmed peripheral neuropathy. Fortunately, she sought treatment before suffering a serious injury. Falls remain one of the leading causes of hospitalization among older adults. A broken hip can dramatically affect quality of life and independence. If you've noticed increasing instability, don't wait for a serious accident to occur before discussing it with your healthcare provider. Before we continue to the next signs, I'd like to ask you a quick question. Have you experienced tingling, numbness, burning feet, weakness, or balance problems? Let us know in the comments below. Many viewers are surprised to discover how common these symptoms really are, and your experience may encourage someone else to seek help before their condition progresses. Now let's continue because the next warning sign is one that many people find difficult to explain. Number 6. Extreme sensitivity to touch. Most people assume nerve damage means losing sensation. However, neuropathy can sometimes cause the exact opposite. Harmless sensations may suddenly become painful. A bedsheet brushing against your feet can feel unbearable. Wearing socks may become uncomfortable. Even light touch can trigger sharp discomfort. This condition is called allodynia. It occurs when damaged sensory nerves begin interpreting normal sensations as painful threats. Imagine turning the volume knob on a radio to maximum. Every signal becomes amplified far beyond its intended level. One woman described it as feeling like sandpaper touching her skin whenever clothing brushed against her legs. Another patient said he could no longer sleep with blankets covering his feet because even soft fabric caused discomfort. This symptom often becomes worse at night, making restful sleep difficult. Unfortunately, poor sleep can create additional problems including fatigue, irritability, reduced concentration, and lower overall quality of life. If normal touch has become painful, it is important to discuss this symptom with a healthcare professional. While temporary measures such as loose clothing may provide some relief, identifying the underlying cause remains essential. Number 7. Muscle cramps and twitching. Have you ever been awakened by a painful cramp in your calf? Or perhaps you've noticed unexplained muscle twitching while sitting quietly in a chair. Occasional cramps happen to everyone and are often harmless. But frequent cramps and twitching can sometimes indicate nerve dysfunction. When motor nerves become irritated or damaged, they may send abnormal electrical signals to muscles. The muscles respond by contracting unexpectedly. Some people experience visible twitching beneath the skin. Others develop recurring cramps in their legs, feet, hands, or arms. One gentleman described it as feeling like tiny worms moving under the surface of his skin. Another said his calves frequently cramped during the night despite staying well hydrated. Although dehydration and mineral imbalances can contribute to muscle cramps, recurring episodes accompanied by tingling, numbness, or weakness should not be ignored. These symptoms may provide important clues about what is happening inside the nervous system. The next 3 warning signs are often the most overlooked because they don't seem related to nerves at all. Yet many people with neuropathy experience them before receiving a diagnosis. And the final sign may surprise you because it affects an area of health most people never associate with nerve damage. Number 8. Changes in your skin, hair, and nails. At first glance, this warning sign may seem completely unrelated to nerve health. Most people don't associate dry skin, hair loss on the legs, or brittle nails with nerve damage. Yet these subtle changes can sometimes provide important clues that neuropathy is affecting more than just sensation and movement. Certain nerves help regulate blood flow, skin hydration, and other automatic functions throughout the body. When these autonomic nerves become damaged, the effects may appear in places you wouldn't expect. You may notice that the skin on your feet becomes unusually dry or cracked. Hair growth on the legs may slow down or disappear entirely. Nails may become thick, brittle, discolored, or grow more slowly than before. One patient in his 70s initially sought medical advice because he noticed progressive hair loss on his lower legs. He wasn't concerned about nerve damage because he had no significant pain. However, further evaluation revealed circulation changes and neuropathy that had likely been developing for years. While these symptoms may seem minor, they can increase the risk of infections and wounds, particularly when combined with numbness. Small cracks in dry skin can become entry points for bacteria. Injuries may go unnoticed due to reduced sensation. That's why changes involving the skin, hair, or nails should never be ignored when they occur alongside other symptoms on this list. Number 9. Digestive problems. This next warning sign surprises many people because it involves a part of the body most wouldn't immediately connect to neuropathy. Yet the digestive system depends heavily on healthy nerve function. Nerves help coordinate the movement of food through the stomach and intestines. When these nerves become damaged, digestion can slow down or become irregular. Some people experience bloating after meals. Others develop constipation that seems resistant to normal remedies. Some alternate between constipation and diarrhea. Others feel full after eating only a small amount of food. Nausea and difficulty swallowing can also occur. Think of your digestive system as a busy highway. Under normal conditions, traffic flows smoothly. But when nerve signals become disrupted, it's like a major traffic jam developing along the route. Everything slows down, creating discomfort and frustration. One retired engineer shared that he spent years visiting specialists for digestive complaints before anyone considered the possibility of neuropathy. Once the connection was identified, many of his seemingly unrelated symptoms finally made sense. If you've noticed unexplained digestive changes along with tingling, numbness, weakness, or balance issues, be sure to mention all of these symptoms together during your medical evaluation. Sometimes the bigger picture provides the most important clues. And now we've reached the final warning sign. This is the symptom that many people discuss with doctors for years without realizing nerve damage may be involved. Number 10. Difficulty regulating body temperature. Your nervous system plays a critical role in controlling body temperature. Certain nerves regulate sweating, circulation, and other automatic processes that help keep your internal temperature stable. When these nerves become damaged, your body's thermostat may begin malfunctioning. Some individuals sweat excessively, even when temperatures are comfortable. Others notice they hardly sweat at all. You may constantly feel cold while everyone around you seems perfectly comfortable. Cold hands and feet may become a daily frustration. Some people experience night sweats that repeatedly wake them from sleep. Others struggle with overheating during mild activity. One woman described carrying an extra sweater everywhere because she always felt cold, regardless of the season. Another patient experienced excessive sweating that disrupted both sleep and daily life. Because these symptoms seem unrelated to nerve health, they are often attributed to aging, medications, or other medical conditions. Yet autonomic neuropathy can be an important underlying cause. When temperature regulation problems occur alongside other symptoms we've discussed today, they deserve careful attention. So let's take a moment to review. Tingling, numbness, burning pain, muscle weakness, balance problems, sensitivity to touch, muscle cramps, changes in skin, hair, and nails, digestive issues, and difficulty regulating body temperature. Each of these symptoms represents a potential warning sign that your nerves may not be functioning properly. On their own, they may seem minor, easy to dismiss, easy to explain away, but together, they can tell a much bigger story. One of the greatest dangers of neuropathy is not how dramatic it begins. The greatest danger is how quietly it progresses. Many people adapt to symptoms so gradually that they don't realize how much function they've lost until everyday activities become difficult. The encouraging news is that early recognition can make a tremendous difference. Identifying the cause of nerve damage may allow treatment to begin before symptoms become severe. Whether the underlying issue involves diabetes, vitamin deficiencies, medication side effects, circulation problems, or another condition, early intervention often provides the best opportunity to slow progression and protect nerve health. If you've recognized one or more of these warning signs in yourself, don't panic. But don't ignore them either. Schedule an appointment with your healthcare provider and discuss your symptoms openly. A proper evaluation may include blood tests, neurological examinations, nerve conduction studies, or other assessments designed to identify the underlying cause. Remember, your body often whispers before it screams. The people who protect their health most effectively are usually the ones who listen to those whispers early. Before you leave, I'd love to hear from you. Which of these 10 warning signs surprised you the most? Have you experienced tingling, numbness, burning feet, balance problems, or any of the other symptoms we discussed today? Share your experience in the comments below. Your story could help someone else recognize an important warning sign they may have been overlooking. If you found this video valuable, please take a moment to like this video, subscribe to the channel, and turn on notifications so you never miss our upcoming health discussions. Thank you for spending your time with us today. Take care of your health, stay active, stay informed, and remember that small symptoms can sometimes reveal important truths. We'll see you in the next video.